To State Parliament now, where the Human Rights Commission and youth advocacy groups have aired concerns over new drug laws. Right now, people caught with less than 50 grams of cannabis for personal use can be referred to a drug diversion program where they get education, counselling or treatment. Laws before Parliament will expand that to the full spectrum of illicit drugs, including cocaine, heroin, MDMA, as well as non-medical use of certain pharmaceuticals. The idea is to treat minor drug use as a health issue rather than a criminal one, thereby freeing up police to chase big drug manufacturers and traffickers and freeing up the courts. To be eligible, you can't have previously spent time in prison for drug offences and you can't be facing other charges. For example, if you robbed a house to get money to buy drugs. You get 3 chances. If you're caught a 4th time, you'll be issued with a notice to appear in court. At parliamentary hearings in Brisbane, there's been broad support for this approach.
We can intervene early and get them the help that they need rather than getting them into the criminal justice system.
But there are some reservations. The new legislation says eligible adults must be offered a drug diversion warning, but for children, it's at the discretion of police.
The provision as it is currently drafted could see criminal proceedings commenced against a child for an offence in which an adult may receive a diversion. This would breach a fundamental principle that children in the justice system should not be treated more harshly than adults.
Queensland Police estimates up to 17,000 minor drug users will be eligible for a drug diversion program in the first year.
Treatment will obviously be different for different drugs, but that will be decided by the treatment service.
But there are also calls for the government to go further and decriminalise drugs for personal use altogether.